Hello. Prior to undergoing your total joint replacement at the Surgical Center Cedar Rapids, you may have been scheduled a preoperative appointment with Rock Valley Physical Therapy. At that appointment, we reviewed your home exercise program, provided a detailed card of exercises that you will perform, talked about gait training with an assistive device, whether that be crutches, front-wheeled walker, or a single-tip cane, reviewed stair navigation, and card transfers. The first thing I would like to go through today is your home exercise program. If you're able to grab your attached card so you can review as we go along, the first exercise you'll perform is called ankle pumps. As the patient, you will sit with your legs extended and you are just to point your toes back and forth as if you're stepping on and off a gas pedal. This can be performed with your legs out straight or even elevated while lying in bed. The second exercise you'll do is called the quad set. What I would like you to do is think about pushing your knee down into the table, okay? What I would like you to do is push down, hold for 3 to 5 seconds, and then relax. Push down, hold for 3 to 5 seconds, and relax. All of these exercises are to be performed for 10 repetitions, 2 to 3 times throughout the day. The next exercise we'll do is called the glute set. This can be performed while sitting or lying down. But what you're going to do is you're going to squeeze your butt cheeks as if your hips were going to lift up off the table. Hold for 2 to 3 seconds and then back down. And squeeze and back down. And squeeze and back down. Good. Go on to repeat that exercise 10 times. The next exercise is called a heel slide. So what you will do is I want you to gently drag your heel back towards your bottom as far as you can. Do not cause increased pain, but a little stretch is okay. Hold for 5 seconds and then let your foot slide back out. Good. Pull that heel back towards your butt again. Hold and back down. Good. And again, repeat 10 times. Your next exercise will require you to use either a small foam roll. You can roll up 2 bath towels or even stuff a pillow underneath your knee. You're going to let your leg rest on top of that pillow. What I would like you to do from there is to, again, tighten your thigh muscle and extend your lower leg out straight, holding for 2 to 3 seconds, and then back down. Good. Contract and lift, and back down. And lift, and back down. Good. The last exercise you'll perform, you can bend up your opposite leg, and then your surgical leg remains out straight. What you're going to do here is you're going to, again, contract your thigh, pushing your knee down to the floor, and then I would like you to lift your leg 1 to 2 inches off the ground, and back down. Good. And lift, and back down. Good. And lift. Good. These exercises are to be completed at home, again, as previously mentioned, 2 to 3 times a day until you have your first follow-up appointment with your outpatient physical therapist.